Hi, I'm Caroline Stoyan, and I'm currently a junior here at Hopkins, where I'm studying neuroscience. Um, I currently work at the Cannabis Science Lab with Dr. Moore. The project that I'm presenting today is modeling opioid withdrawal in rats. The United States is currently facing an opioid epidemic. It's estimated that over 2 million people in the United States have opioid use disorder. One of the barriers to recovery is opioid withdrawal syndrome. And if you look at figure one, this is a schematic of opioid withdrawal. In humans, acute withdrawal is in the first 2 to 3 days after the discontinuation of opioids and includes severe flu-like symptoms such as nausea, muscle aches and pains, diarrhea, and vomiting. Protracted withdrawal peaks around 5 to 7 days after discontinuation and continue for up to a month or more. This includes craving and symptoms of craving, sleep impairment, mood disruption, such as anxiety, irritability, and depression. This withdrawal syndrome has been well characterized in humans and follows this like two peaks of withdrawal. Opioid withdrawal is currently treated with opioid-based medications such as methadone, buprenorphine, and Suboxone. However, as these medications are acting on the same receptors as opioids, there are often concerns about treating OUD with medications that continue to work on the same receptors, as there can be continued misuse, dependency, and perhaps it takes longer for the nervous system to um, be back to normal. So new non-opioid medications are wanted to treat these symptoms. Our lab is currently testing to see if cannabinoids such as CBD and THC and other experimental drugs that work on the endocannabinoid system can be viable treatments for alleviating symptoms of opioid withdrawal. In order to test these new treatments, we first need a baseline model of opioid withdrawal in rats. The goal of this project was to characterize the time course of opioid withdrawal in rats in order to effectively design our future projects and give us a better understanding of our data. And no one has really done this before, so it's really helpful to have a comprehensive time course of an opioid withdrawal syndrome and a preclinical model. Um, in terms of methods, we tested both male and female rats, and they were randomly assigned to either the control group or the treatment group. The treatment group received injections of morphine in ascending doses from 10 to 50 mg per kg for 5 days, and then maintained on 50 mg per kg for 5 days. The control groups were given injections of saline. After 10 days, injections were discontinued. Body weight and food intake were measured daily throughout morphine administration and withdrawal. Behavioral tests were conducted for 7 days following morphine discontinuation, and these behavioral tests are our way of measuring how the rats are feeling, as they can't tell us, and the severity of their symptoms. We measured somatic symptoms of opioid withdrawal through behavioral observations. Um, so we put the rats in clear boxes and video recorded them for 10 minutes. And then we had trained observers score these behaviors, uh, and certain behaviors indicated signs of opioid withdrawal. And so these behaviors included escape jumps, abnormal posture, wet dog shakes, and grooming. Pain sensitivity, as pain sensitivity is known in humans to be increased during withdrawal. So we want to test if this was the same in rats. So pain sensitivity was measured with the Von Frey test. The rat's paw is probed with filaments of increasing force until they pick up their paw. This is a measure of how sensitive the rats are to mechanical stimulus. We also measured anxiety-like behavior, as that is known to be a symptom of both acute and protracted withdrawal in humans. We measured anxiety-like behavior at 3 different time points with the elevated plus maze, open field test, and defensive withdrawal test. These tests are an exploration based, where greater time in the open arms of the elevated plus maze, center of the open field, and outside of the enclosure of the defensive withdrawal test, there's like a tube in the middle where the rats can hide. All this indicates lower anxiety. And so these tests were chosen so we can measure psychological symptoms and physiological symptoms of withdrawal. I participated in running these tests. And on test day, we run these sequentially, and so we have several people helping out. So I'm assisted with testing days, and I was also trained to score the videos of the behavior and turn those videos into data. In terms of results, we can see here anxiety-like behavior, and there are significant difference between the controls and the opioid withdrawal rats in all three tests. We see that opioid withdrawal rats spend less time in the open arms at 14 hours. They spend less time in the center of the field at hour 24, and more time in the beaker of hour 62. This indicates that through acute withdrawal and into protracted withdrawal, opioid withdrawal rats experience heightened anxiety, and there are no sex differences between males and females. Now, looking over here at figure 2, we see for both males and females, body weight falls in acute withdrawal. This indicates that the rats are potentially experiencing nausea and loss of appetite. And then from day 3 to 7, body weight begins to recover. So lower, back up to normal. We see a similar drop in food intake on days 1, 2, and 3 for both males and females before it increases, which again suggests that the rats are experiencing a loss of appetite and generally not feeling well. So we see that these specific effects are more severe in days 1, 2, and 3. And then in 4, 5, 6, and 7, things return much more back to normal. And figure 3, we have the somatic time course. And then this shows that the somatic symptoms begin to peak at 38 hours post morphine discontinuation, and then begin to fall, but that there is another peak around 4.5 days, indicating symptoms into protracted withdrawal. So this is kind of indicating that even though the rats begin to feel better, it is not clear recovery, and that there are spikes of withdrawal symptoms. We also see here that females have a higher withdrawal score that indicates that their symptoms may be more pronounced. So this is an interesting sex difference. Pain sensitivity is in figure 4. So peak hyperalgesia or increased sensitivity to pain peaks around day 4, particularly in males. Here we see some pretty pronounced sex differences between males and females, especially our male and female controls. This indicates that this effect is either specific to male rats or just more pronounced in male rats. We can also, go into hypothesizing that there is something like a social transference of pain in the female rats, that may be why the control rats are decreased in females. Tolerance to pain. But this is definitely like an interesting result with some pretty clear sex differences. So that's like very important to take into consideration. In conclusion, we see that twice daily injections of morphine produce a robust spontaneous withdrawal syndrome in male and female rats. Somatic symptoms peaked at 38 hours post morphine discontinuation, while hypoalgesia peaks around 4 days into withdrawal and is more pronounced in males. Anxiety-like behaviors are increased at the earliest time point and persist through the acute withdrawal phase. These results will help us to determine what time points are optimal to test depending on the focus of the study. Some medications might want to focus more on somatic symptoms, and some might want to focus more on psychological symptoms. This time course informs when the peak of symptoms occur and therefore points to when it is best to test. An important thing to mention is that we are currently about to start testing on a second cohort of rats in order to increase our sample size and stability of data. And we are going to use, the information that we learned in this time course in our current other studies that are testing CBD and sterokaryoprotein inhibitor 1, which is an experimental drug that works on the endocannabinoid system similar to THC. So we're, really appreciated of this study and having that baseline to compare our data to. Thank you, and I hope you enjoyed this presentation.